Hi, my name is Dr. Joseph Duchesne. Welcome to your Chiropractic Minute. Today we're going to talk about applied kinesiology and some muscle function tests. Now, in applied kinesiology, we use muscle testing to figure out where different areas in the body are functioning appropriately, whether they're working right or not. Now, one of the areas I want to talk about is function of your foot, hip muscles, and some of your hip stabilizers. Now, there's a correlation between some of the bones in the foot and some of the muscles in the hip, so that when some of these bones in the foot go out of line, some of your hip muscles actually stop working. One of the bone muscle combinations I want to talk about is in the lateral side of the foot. On the outside of that foot, one of those bones called the cuboid, when that starts to go out of alignment, it shuts off a muscle inside your hip called your glute med. This is the main stabilizer for your pelvis. So for a lot of people, if you happen to have a lot of hip problems, whether hip core issue, SI joints, or just some kind of instability or pain inside of the hips, and you've tried many things like regular chiropractic or massage therapy, acupuncture, a lot of other things that aren't really quite hitting it, sometimes the reason why this hip isn't working is because the bones in the foot are out of alignment. Now this is something that anybody who does applied kinesiology can find out, is where their problem is. So the problem is over here, and where does it come from? It doesn't come from here. This actually comes from the foot. So I can treat the hips all I want, but the problem will not go away until I deal with the foot. So kind of an introduction to applied kinesiology where we have pain or dysfunction in one area, but the actual symptoms are someplace else. So again, thank you.